Hi, it's Paul Hagan with Adroit Surgical, and thank you all for joining us to do the Vie Scope training today. So I had to turn off everyone's audio, but any questions or raising your hand, you can do that through the chat button. So send us your questions. I'm going to kind of run through it a couple different times, show you from a couple different angles. I sometimes can't hear or think the audio is better, so I'm wearing my headset. You might want to do the same. So let me switch cameras here, and we'll go through our normal mnemonic and get started. All right, so typically we're intubating, we're starting in midline, and on any road trip you want to know the landmarks, and we're going to use the mnemonic 10. The roadmap to intubation is 10. Tongue, epiglottis, notch. We see the tongue, we're looking through the barrel for the epiglottis. I instantly visualize that, and I pass the bougie. Follow your standard protocol, select the proper tube size, intubate your patient. So a lot of people are used to a Mack or Miller, which is great, but what we're trying to do is we're trying to give everyone a grade 1 view so that they have the highest chance of intubating as quickly as possible. So with a Mack, getting a grade 3, grade 4 view. With the Vie Scope, you're going to get a grade 1 view every single time. Tongue, epiglottis, notch, pass that in. So show it to you from a different angle. Okay, so from the side, same thing. Tongue, epiglottis, notch. I'm able to visualize those vocal cords, pass that bougie, select the proper tube size, follow the proper protocol, inflate the cuff, and ventilate my patient. One more time from above, and then we'll show you from inside. Tongue, epiglottis, lift it up, notch, pass that bougie, select the proper tube size, proper depth, inflate my cuff, move the bougie, and ventilate my patient. Check for bilateral breath sounds, check for capnography. So what are we looking at from the inside? Switch to that camera. So same thing, I just put a little endoscope on Vie Scope here, and we're coming in, tongue, looking for the epiglottis, come underneath the epiglottis, I raise it up, visualize those vocal cords, and pass that bougie. When you're going straight down our barrel, you can't miss. There is no, oh, I can see it, but I just can't get there. You're gonna get there each and every time. So bougie's in place, select the proper tube size. We want to watch the tube pass. We just watched the bougie pass, but we could watch the tube pass each and every time. Out, in. So move that bougie and ventilate our patient. So let's switch back to the other cameras. I want to show one other technique, teach you how to intubate like an ENT surgeon, not like a trauma doc, not like a paramedic, but to go paraglossal. So as you might have noticed, we were touching the teeth. You can gently push pressure on the teeth without any problems with the Vie Scope. But if you have any kind of facial trauma or you are worried about the teeth, you can go paraglossal, which means bypass the molars. So you go to the corner of the mouth, and we're able to visualize those vocal cords in seconds, pass that bougie, and intubate our patient. Do it on this side, not touching any teeth, bypassing the molars, visualizing those vocal cords, passing that bougie, selecting the proper tube size, proper depth, inflate my cuff, ventilate my patient. So I know I'm trying to make it look simple. It is simple. There is no difficult. I'm trying to show you the tips and trick. This patient here, we've got a C collar on him, so I'm not allowing you to put the head in the proper position. I've super inflated the tongue. There's a very anterior airway from the manufacturer. So let's, I see a couple questions come in. So let me flip back and read that. All right, teeth. It looks like you were touching the teeth. I've always been taught not to touch the teeth. Correct. So yes, that is what you've been taught. And we are allowed with the Vie Scope to gently put pressure on the teeth because we have 80 years of proof that ENT surgeons who intubate with a metal scope on the teeth, pressure on the teeth does not break teeth. When we slip and impact the tooth, that jarring impact, that's what chips teeth. The Vie Scope, you will not chip teeth, or you can always go to the Paraglossal and never touch a tooth if you have any kind of worry. So another question. Oh, I love this. Great. So somebody is commenting that I was using the wrong hand. So absolutely. The Vie Scope, you can use it right-handed or left-handed. Why? Because there is no channel on the right-hand side that dictates that you have to use it with your left hand and pass a Bougie or endotracheal tube on the right-hand side. So with our barrel, you're passing straight down the middle. So the 10% of paramedics and emergency room doctors that are left-handed are going to love this. But yes, you can use it left-handed or right-handed, you know, whatever fits your preference, because you're going to pass that Bougie straight down the middle again. If I'm using my left hand, you can actually see it a little bit better. Visualize the vocal cords and pass that in. But I can absolutely do it with my right hand. Visualize those vocal cords. Keep my eye on it at all times. That's what we're trying to do. We're trying to give you the ability to see what you're doing at all times. So let's see here. Back to the top camera. Give me a second to read another question here. Yes. So one of the questions was the Bougie. It's an extra step. Why would I want to put an extra step in? Well, two things. One, it's simple physics. You know, is it going to be easier to get this thin little thing down the hole or this big fat thing down the hole? So with the Bougie and the science is there, using a Bougie first and using a Bougie every time is going to increase your first pass success rate. So that's one of the primary goals that we have with the Vie Scope is to make every difficult intubation simple and to make first pass success every time. So while the science says that Bougie is going to take 4 to 6 seconds more, in the total time to ventilation, the Vie Scope is being proven to be 20 to 30 seconds faster. So, and anytime you use a Bougie, your success rate is going to go up from 80% to 90, 95%. So taking that extra couple seconds, having that straight line of sight with the Vie Scope, passing that Bougie, is not going to, it's actually going to be faster and easier. And, you know, there is no skills, there is no tricks. You're just seeing exactly what you're doing. You're seeing that glottic opening and you're passing the Bougie. Can you show the Paraglossal again? Absolutely. So I get it. You know, we haven't been taught this. It is a little bit different, but let's just pretend that there is facial trauma, car accident, gunshot wound to the face, whatever you guys have seen out there in the field, or big buck teeth, or you just don't believe me that you can touch the teeth. Going Paraglossal, bypassing the molars, you are going to use less arm strength. You're going to get to it faster. But I always try and show that as a second technique because, you know, I want you to do what you're normally doing going in midline. So Paraglossal again, I see the tongue. I'm coming over to the corner of the mouth. I'm trying to keep my hands out of the way here so you can see it. Visualize those vocal cords. I'm way far back away from them, and I'm passing that bougie. So let me try and show from another angle. This is going to be a little bit different. But once you've done it once or twice, you probably won't switch back because it is so much faster and easier. It takes so much less arm strength. So coming in, corner of the mouth, I'm really far back here away from the patient, and I'm able to intubate the patient. Great. So yeah, I was asked what was the mnemonic. The mnemonic that we teach is 10, tongue, epiglottis, notch. The notch in the vallecula points you right toward the vocal cords. So see the tongue, I'm looking down the barrel the whole time. I go underneath the epiglottis, I lift it up, visualize the vocal cords, and pass that bougie. So the two mistakes that I see when I do training face-to-face, and as we switch into, maybe you guys can turn on one of the conference room cameras and I can kind of watch this. I see this 1% of the time. I see guys still trying to go up, up and away, and you can do it, but it sure is a lot harder, and we make it a lot simpler. I see guys try to push the bougie on the outside and fight the anatomy, whereas if you go straight down, you're going to fillet the vocal cords each and every time. Also, with any laryngoscope blade, Vie Scope included, if you go in too deep and, oh my gosh, all I see is pink mush, what do? You just back up a little bit, start looking for those landmarks. All right, there's my epiglottis. I'm getting underneath it. I lift up, I see the notch. Okay, it's pointing me to the vocal cords, and then I'm straight in there. So, cool. So that's down and dirty. That's real quick kind of training. And if there's no more questions, we'll try to turn this over. I'm not seeing anything more on chat. So if there are any questions, raise your hand, or I'm going to stop the recording features so that I can see your audio and video, and we'll continue the discussion and continue to work on training here at a safe distance here because of COVID. So thank you, and I'm going to turn off the recording so I can see your audio. Thank you.